Hello, my name is Jordan Garcia, and today I'm going to be performing the Foley catheter checkoff on a female patient. So let's get started here. Let me just set up my camera. There we go. Alright, so the first thing I'm going to do is I'm going to pull up my EHR and make sure that I have the right patient. I have Anna Powolowski, date of birth 5/5/1957. She has an allergy to penicillin and her reaction is hives. The next thing I'm going to do is I'm going to go ahead and check and make sure that the healthcare provider has put in the order for the procedure, and I can see here that it is. He ordered it for urinary retention. We're going to go ahead and place that today. So I'm going to go ahead and go to the supplies room and gather all my supplies that I need. So today what I need is I need my Foley catheter kit. I'm going to have procedure gloves. These would be in the patient's room, but I don't obviously have a patient room, so I'm going to bring those with me today. I'm going to bring an extra set of sterile gloves just in case, and I'm also going to bring some tape, and then I'm also going to bring anything that I would need for perineal care, so my wash basin, my soap, my rags, whatever my institution uses for peri-care, I would bring that with me as well. And then I'm also going to make sure that all of my supplies is non-expired. So it's all good to go. So once I have all my supplies gathered, I'm going to go ahead and go to my patient room. I'm going to knock on the door. Come in. Hi, Miss Anna. My name is Jordan. I'm going to be your student nurse today. I'm going to sanitize my hands. Alrighty, can you please tell me your name and your date of birth? Anna Powolowski, 5/5/57. Perfect. That matches your wristband, and that also matches what I have in the chart here. And Miss Anna, do you have any allergies? Penicillin. Okay, and what reactions do you have? Hives. Perfect. Alrighty, that matches what's on your wristband as well as what's in the chart as well. So then I would go ahead and provide privacy by closing the curtain and closing the door. Then I would go ahead and make sure that our area is safe. So I would make sure the bed is in the lowest position. The side rails are up. She doesn't have any clutter on the floor. She has all of her walking aids near her, and she has her call bell within reach. So once I've assessed safety, I'm going to go ahead and give my patient education on what we're going to be doing. Alrighty, Miss Anna, well, I'm here to insert a Foley catheter that the doctor has ordered today for urinary retention. You're having some trouble going to the bathroom, is that correct? Yes? Okay, perfect. Have you ever had a Foley catheter inserted before? Yes? Okay, and have you ever had any problems with it being inserted? No? Okay, and have you also ever had any problems with your urethral stricture or any kind of surgery on your urethra? No? Okay, perfect. If she would have said yes, I would have stopped the procedure and contacted the healthcare provider, but since she said no, we're going to go ahead and proceed with the procedure. So then I would go ahead and perform hand hygiene and put on my procedure gloves. Oops. Okay, now I have my procedure gloves on. I'm going to go ahead and raise her bed to a working height so I have not hurting my back or anything. I'm going to go ahead and lower the side rail on the side that I'm going to be working with. And I'm going to position my patient and get her ready for the procedure. So I'm going to lie her flat if she's sitting up. And I'm going to have her in the dorsal recumbent position. So what that means is I'm going to let her know that I'm going to raise her lower half. Miss Anna, I'm going to raise the bottom of your blanket here. I'm going to keep your top half covered so you're still warm. But I do need to lift up the bottom half. So I'll go ahead and lift up the bottom half. And for the dorsal recumbent position, we're going to have them lying flat on their back. We're going to have them bend their knees. And we're going to have them relax their hips or their thighs. And we're going to rotate their hips outwards, just like this. So now that I have her in position, I'm going to go ahead at this time and do peri-care. So if she was in adult briefs, I'll go ahead and do her peri-care if she had any stool or any urine that she had on. She doesn't have any peri-care that's needed at this time, so I'm going to go ahead and observe for her urinary meatus. I have my gloves on. I'm going to go ahead and observe. So I'm able to see the urethral meatus here. So once I have that done and I have her peri-care is been completed, I'm going to go ahead and remove my gloves. and perform my hand hygiene. Okay, so this next part, I'm going to get my supplies ready. You can either do this with another set of procedure gloves on, or you can do it with clean, ungloved hands. I'm choosing to do clean, ungloved hands because I only got one set of gloves that I already threw away. So, move my patient chart out of the way really quick. Move my other supplies out of the way. I'm going to go ahead and open my catheter tray. I'm going to throw this away right here. I'm going to throw this away as well, but I'm going to make note of the size catheter that I use so that when I document later, I know this is a 14 French. So we'll go ahead and throw that away. Alrighty, next I'm going to be opening my kit with a sterile procedure. So I'm going to go ahead and turn this. I'm going to start by opening it away from me. Okay, and then I'm going to open the sides. And this is at the end of the patient's bed here, so that I have room. And then lastly, I'm going to open it towards me. And I'm going to give a little tug so that it lays nice and flat for me. And this outer 1-inch border of my field here is non-sterile, so I'm going to use that to kind of position it in a square so that I don't contaminate there. So now that it's in a square, I'm going to go ahead and start opening my kit here. I'm going to take the blue drape and grab it by the corner. The shiny side is going to go down and the dull side is going to go up. So I'm going to use my 2 fingers, pick it straight up, and let it fall open naturally. Help it if it needs to. And I'm going to grab it and just lay it flat on the patient and drop it. I can adjust it with my sterile gloves whenever I get them on. Now I'm going to get my sterile gloves on. I'm going to grab it. Okay, and before I put my sterile gloves on, I'm going to clean my hands one more time. Okay, now I'm going to put my sterile gloves on using the sterile technique. I'm going to pick up and step back and insert. Drop it. I'm going to do a scoop, watching my thumb so that I don't contaminate. And step back and insert as well. Okay, adjust if I need to, but I put them on good, so they're good. Now I'm going to go ahead and take my fenestrated drape, which is my white drape here, and open that as well. But before I do that, since I have my sterile gloves on, now I can adjust my blue draping without contaminating my surface there. So I can go ahead and tuck it if I need to. Now I'm going to take my fenestrated drape and open that as well. Pick it straight up. Let me turn it back so you can see. Take that as well, open it up, and drape it onto the patient as well. Take it and just lie it flat. Only exposing the perineal area. And I can adjust that as well. Okay, perfect. So now that I have her draped how I need her, now I can go ahead and start with my kit here. I'm going to go ahead and open it. Okay, then I'm going to take out my cleansing solution and I'm going to open it and douse it onto my cotton balls here and throw it into the trash, keeping my hands above my waist so I don't break sterility. I'm going to take my lubricating jelly and put that into my little tray here. Throw that in the trash as well. Okay, while that's doing its job, the solution is doused on the cotton swabs. I'm going to go ahead and now inspect my Foley catheter. I'm going to make sure my tubing doesn't have any kinks in it, and I'm also going to make sure that my catheter clamp is closed. Next, I'm going to go ahead and remove the protective covering on the catheter tubing, making sure not to let the tip touch anything by wrapping my hand around. Okay, and I'm going to drop that in the trash. Okay, now I'm going to take the tip of the Foley tubing and place it inside the lubricant. Okay, and I'm going to take the syringe of the sterile water and take the cap off. And I'm going to attach it to my Foley kit so that I don't have to do that later. Okay, now that I'm ready to clean my patient. So what I'm going to do is I'm going to take my non-dominant hand, place it on her labia, and spread them so that I can clean. I'm going to take my dominant hand and use my forceps to pick up the Q-tip, the cotton swabs. So I'm going to place my hand here, and once it's here, it's stuck here. I'm going to take my dominant hand and pick up my forceps and start cleansing the patient. And to clean the patient, what we're going to do, we're going to start on the farthest labia and go in a one swipe top to bottom. So we're going to start farthest edge, one swipe top to bottom, drop in the trash can beside us. Okay, next we're going to take our second swab. Now we're going to do the closest one to us. And we're going to do one swipe top to bottom. And we're going to drop it in the trash can next to us. One last one. We're going to do the center. We're going to go one swipe top to bottom. And this whole time I made sure I haven't broke thoroughly by going over my steel field. I've been going around. So now that we're done cleansing, I can go ahead and throw my forceps away too. Now we're going to take the tubing out of the lubrication, and I'm going to tell my patient, okay, Miss Anna, we're going to go ahead and insert the catheter now. So what I'm going to have you do is I'm going to have you bear down, okay? So we're going to have the patient bear down, and we're going to insert the catheter. And we're going to insert the catheter until we see urine. So I see urine. So what I'm going to do is I'm going to advance the catheter another 1 to 2 inches. And then I'm going to take my non-dominant hand, and I can now grab the catheter with it to secure it. And I'm going to take my dominant hand and inflate the balloon now. Okay, once I've inflated the balloon, I can go ahead and drop the catheter. I can take off my syringe, and I can throw that in the trash. Then I'm going to give my Foley catheter a little tug to make sure that the balloon is in the bladder and that there's some resistance there, so it's not going to come out. Once I've done that, I'm going to secure it to the patient's leg with my tape. And I'm going to give the patient a little slack. That way when they move, there's no damage to the urethra inside. I'm going to give them a little slack there. I think that's good. And I'm going to tape it down at the bifurcation here onto their leg. Okay, then I'm going to take the bag and I'm going to attach it to a non-movable part of the bed. And it's going to be below their waist, below the urethra. Alright, now that I have that attached, I can go ahead and if she needs any additional pericare, I can perform that. But she doesn't. We were able to keep her nice and clean. So now we can go ahead and clean up our supplies. I can throw all this away. Alright, Miss Anna, you did good. How are you feeling? Good. Okay. Now that she's all covered up, I can go ahead and take my gloves off. Throw that in the trash and sanitize my hands. And then once I do that, I can go ahead and throw the rest of my trash away. Okay, and then once I have my trash thrown away and my hands are sanitized and everything, I'm going to go ahead and pull up her chart again. And I'm going to document in the computer that I did the procedure. I'm going to document the size of the Foley that I used, so the 14 French that I said earlier. I'm going to document that the patient tolerated it well. I'm going to document, how much urine we got out of the Foley catheter when we inserted it. So how many mLs we got. I'm also going to document the color and the consistency of the urine, if there was any odor or anything like that. I'm going to document how much sterile water that we put into the balloon, and I'm also going to document how many times it took me to insert the catheter. So it only took me one time, and I put in 10 mLs into the balloon, and the patient tolerated it well. So once I have everything documented, I'm going to lower the patient's bed to the lowest position, raise the side rails back up, make sure the patient is comfortable. Since they are laying down, if they want to sit up, I'll sit them up. I'll make sure they have their call bell within reach. They have any walking aids near them. There's no additional trash on the floor. Ask them if they need anything. Lowest position, side rails up, call bell, no trash. Comfortable. And then once I've documented everything, they're all comfortable, my supplies is discarded, I will go ahead and sanitize my hands and exit the room.